The bipolar disorder used to be called as manic depressive illness previously. It's a serious brain and behavior disorder where the person can go through very intense mood changes and energy changes. And about 6 million people in this country suffer from this illness. And sometimes they can go for years before they are diagnosed or treated. The symptoms of bipolar disorder include the episodes of mania and depression. During the manic episodes, the patients usually will experience a very high elated mood. They are full of energy, they are a natural high. Sometimes they will go to the spending sprees. They will begin to use drugs and alcohol more excessively. And also their thoughts race, they talk fast, their ideas go too fast. And at times it can lead to a lot of anger and aggression in patients. And then the lows are, of course, during the periods of depression, they will go through the low mood, the sadness, depression, crying spell, no energy, changes in appetite and sleep, social isolation, lack of ability to experience any happiness and joy, and sometimes the thoughts of suicide and death. The diagnosis of bipolar requires a visit to the mental health professional and a medical physician. They will go through the history, the course of the illness, the family history, and the mental status exam to establish a diagnosis of bipolar disorder. And at times it does require some of the lab tests and investigation to exclude some of the physical illnesses that can mimic the symptoms of mania or depression. Lately, we have begun to identify the different types of bipolar disorder. The bipolar one, which is the more classical type of bipolar disorder, where you see the full-blown manic episode and the severe depression. In bipolar 2, you see just the hypomanic episodes with the depression, and the cyclothymic disorder, where there's mild depression, which is more lingering, lasts long, and it alternates with the hypomanic episodes. Unfortunately, again, like a lot of other psychiatric illnesses, there's no cure for bipolar disorder, but symptoms are definitely manageable and treatable. Usually the treatment of bipolar requires the use of medications in combination with psychotherapy. The medication generally used are the mood stabilizing medications, which are lithium is the most widely used medication as a mood stabilizer. Along with that, some of the anti-epileptic medication they have been used lately to stabilize the mood. And when the patients are going through the acute episode of mania and depression, you can use the antidepressant and antipsychotic medications in combination with the mood stabilizing medication. Of course, with the talk therapy, you need to get the proper guidance, education about the illness, and the support system mobilized to have the better response to the treatment.